The day of April, and it's time to chat with one of our friends, one of our buddies in the studio with us, Dr. Cherny here. How are you, my friend? Good to see you, bud. So today we're talking about something that I think a lot more people will talk about as we inch closer to Mother's Day.
Mother's Day is not that far away. It always comes fast. It always comes really fast after Easter.
So looking for something very unique for Mother's Day?
Okay.
Well, what we do the most of is actually the mommy makeover. And the mommy makeover, the whole idea of this really is grown out of the fact that if you actually look at the statistics of plastic surgery, 90% of plastic surgery is done on women, and it's only 10% on men. And that's actually a higher percentage of women than it was 10 years ago.
Oh, it is?
It is. Well, that's because, you know, the Botox and the fillers and everything have skewed the percentages even more. But the reason that we really do more plastic surgery on women is that women are the ones who take the hit from having children, and that's why we call it the mommy makeover. And classically, it's a tummy tuck and a breast lift, actually. But there's so many other things you can do. It's all individualized.
Like, what else can you do besides those two? Those are the most popular.
Those are the two most popular, but you know, you could always, let's say, you know, if your breast, it's funny, pregnancy, everybody takes the hit a little differently. Sometimes it's the tummy, but it's amazing. I've seen women with six-packs after tummies, and I can't believe it, but I think it has to do with how big your baby is and how much weight you gain during pregnancy. So it affects everybody differently. So for some, it's just the breasts that become damaged by the pregnancy. For some, it's just the tummy. For some, it's like even the arms, and we do arm tucks for them.
And it's not just plain old fat, right? It's the actual extending of the abdomen, and it does things to the muscles, like the muscles come apart, or
they do. That's exactly right. The muscles spread apart, and so you get a belly that doesn't go away no matter how many sit-ups you do. It's stuff like that. And there is one thing when you're pregnant, especially in the last stage of pregnancy, your body releases a hormone that relaxes your connective tissue, and so you're so prone to getting stretch marks, and you're so prone to
I didn't realize
stretching.
That.
Yeah, it's actually essential to help the delivery of the child.
Is it possible that I have that hormone? Is that my problem? that you know that maybe I've.
If you do, I do. That's for sure.
So what's the recovery of something like that? I know you said it's very individualized and everybody's a little bit different, but if they're looking into this, maybe for a Mother's Day gift, what would be recovery or setup for something like that?
It's surprising. Techniques have improved. We can now place long-acting local anesthetics, so you actually don't feel anything for 3 days after the surgery.
3 days?
Yeah, it's crazy. The biotechnology is just so good. The drugs are so much better. So, I mean, it's not unusual to have, whether it's breast implants or a breast lift or something like that, that's just like a weekend recovery. And so is lipo, for that matter. Tummy tuck, you know, if you have the big muscle reconstruction, well, then maybe it's 10 days. And maybe it's 10 days, but it's not bad. And that is so important because people are working so hard now, and they can't get time off from work.
Right.
And, you know, if you get time off from work, you'd rather go on vacation than be recovering from a surgery.
Right. That's true. That's true.
That's why I get the summer off.
And, and speaking of vacations, we touched on this a while ago too. We told you the pros and cons about going on vacations to get some of this type of surgery done. Not a good idea.
Well, you know, I've seen, the problem is quality control. I've occasionally seen someone come back with decent results. In fact, I saw somebody come back from Dominican Republic who had like whole bunch of stuff done, and it was like dirt cheap, and it actually didn't turn out that bad. But she was having a real hard time having someone just take her stitches out and that kind of thing.
Sure.
But for every one like that, there's two that came and the results are mediocre, like they have lipo and they're all like lumpy, and or they have an infection. I have one woman that spent probably 3 times in the end getting things fixed as she spent on her plastic surgery vacation in Costa Rica. It's a crapshoot. You might find someone that's decent, but you might find someone that, you know, got their medical degree off the back of a matchbook cover or something.
Yeah.
Right.
But speaking of cost, that's something that we should address here too, because cost can be not manipulated, but can be controlled, right?
Oh, absolutely they can. And like I said, actually the prices of cosmetic surgery have really gone up in Mexico, and I don't think it's that much cheaper. So I have a lot of patients, for example, that used to go back to their family's hometown in Mexico that now stay and have it done here. But you know, when you're talking about surgery, breast implants run around $6,000, and a breast lift is about the same. If you get like a super big tummy tuck, it's like $9,000, but it's maybe half of that if you don't need as much work done.
Okay.
Now,
That's the kind of stuff we're talking about.
What about paying for this? How do people go about doing that?
Well, every once in a while, I always feel more comfortable when people save up for it. and they take their time making the decision. And some people just save up for a couple of years and then pay that way. But you know, this is America, so everybody does things, you know, not on impulse so much, but it's, you know, on credit. So
they
there's
want
a
it
lot
now.
of,
They want it now.
well, yeah. So a lot of my patients do it on credit. They do, and there's companies that just do this, like orthodontics and stuff. Care Credit is the big one.
Okay.
And you can just, you know, it's like you can qualify online like in 60 seconds. So.
Okay. It can be financed then.
Yes, yeah, there's a lot of people into that.
Well, let's say someone who just wants to talk to you about it. They're not sure if it's right for them, but they just want to come in and discuss their options with you and see what they could possibly do. Can they just come in anytime and set up an appointment? That's
actually the best thing. You know, that's really the best thing. And you know, you need to, and a lot of my patients try other plastic surgeons, and you got to find the one where the chemistry is right. So yeah, we want people to just come in and just say hi, either at our seminars or I'll see somebody in consult where I can really look at somebody and see what they really need.
All right. Well, if you're looking for somebody who's easy to talk to and fun to talk to, this is the guy because you'll have a good time if nothing else. Wonderful. Dr. Cherny, thank you so much. And
God bless you guys.
Where to find Heartland Plastic Surgery Center over there on Hickman Road, over on the west side of town, 254-2260.